Hey, this is your girl Kanisha. I'm here with another video. I just want to give you guys some updated information and just some history about myself and my trying to conceive progress, or my journey, or however you want to call it. I just want to talk to you guys about my HSG, the medications that I'm currently on, and also my experience with Clomid for the second cycle, or the second round. As you all know, this is my second HSG. The first time I had an HSG was it was June 2014, which was last summer. I had that procedure done along with them draining ovarian cyst. So during that time, during the first HSG, I was asleep. This time I was wide awake, so I was able to know exactly what was going on. And when I tell you it was an experience to feel, I kind of didn't like it, to be honest. But anyway, the procedure did not last no more than 10 minutes. I had instant results, and basically it's just like a regular PAPS. It's just like, first they have to swab, I guess, check any type of vaginal discharge or whatever, pH balance and stuff like that. But they had to check that. They also, once they put the catheter inside of my cervix through my uterus, they pushed that through. And you guys, when I tell you it was painful, I'm talking about painful for me. I did take my Midol. I took my pain pills like they told me to, but honestly, my SIS was not as painful as my second HSG, just to be very honest with you. Especially when they had to roll me over from left to right to get pictures of both sides and to see how the spillage was. It was painful. I didn't like it. I almost shed a tear, but I was a strong girl. But it was kind of painful. But anyway, what else happened? And like I said, it was done within 10 minutes. It was like really, really quick. But from my first HSG, I was told that I had scar tissue, blockage. I was told that my left tube was basically severely damaged. And I was kind of hesitant about this second HSG. I will tell you one medication that I did take. I took serapeptase. I think it's by Doctor's Choice. You can order it off Amazon, I believe. Yeah, Amazon. It's called serapeptase, Doctor's Best. And I took the high potence kind, so I can go ahead and get everything I need, and with either 1 or 2 pills, and it worked fine for me. But anyway, and I did a lot of praying. I didn't want to receive the news that they gave me from the first one. It was a strong possibility that I was not going to have any kids based on the condition of my left tube, because they did remove my right. They was telling me that my only option was IVF, but I really felt down in my spirit that IVF was not my only option. It had to be something else out there. And that's when I went to go researching, and I found serapeptase, and I was like, okay, well, this may be something. At least I'll just take it just to see what it do. But you guys, I had my HSG done Friday morning. When I saw the x-ray, spillage. There was no blockage, no scar tissue, no nothing. I actually saw it for myself, and it was like a lot of spillage. So that lets me know that my tubes were wide open. As the doctor said, my left tube is wide open. So it's, within the first 2 to 3 months, cycles, you're very fertile, because whatever was in your tube is now flushed out because there is spillage. But of course, if it was blocked, I wouldn't have any spillage. So I'm kind of excited that I was able to see my own x-ray and to see that my left tube is open. But anyway, but that was just my experience with my HSG. It was very painful. That night, it got worse for me. I was very gassy. I was bloated. And I had to use the restroom, number one. I had to use the restroom more often. I'm not sure what caused the problem, but I did call a nurse, and basically they was just telling me unless I have a fever over 100, then just take some pain pills. And that's what I did. I took some pain pills. Matter of fact, I took some Tylenol PM. Took the Tylenol PM, went to sleep, woke up the next day. I was fine. Because it was to the point where I couldn't even walk at night. And I was just like, something got to give on this one. But anyway, but that was just my experience with my second HSG. I'm glad that I did have it. I feel more confident that I'm able to conceive very, very soon based on those results. I am still waiting on my SIS results. I should be receiving those from Art Fertility within the next couple of days, or the beginning of this coming week. Anyway, what else I said I wanted to talk to you guys about? My medications. Okay, like I told you, when I first went to our clinic here in our city, they did a lot of blood work to see what was wrong with me, where did it start for me, where was my progesterone level, where's my just a whole bunch of medical stuff, to be honest, but you can't remember off the top. But what they did check my D3. My D3 was kind of low, so they just told me to take some D3 supplements, some vitamin D, as you guys know, or you can really go outside and enjoy a beautiful day, but because you can get your vitamin D from the sun as well. But I started taking the supplements. What else? They also put me on Metformin. It's Metformin. I believe that's how you spell it. But it's a diabetic medicine. It's to control your insulin level because mine was kind of high. So they prescribed me that along with taking Clomid. So they have me on like a few different kind of medications. Last cycle I was on Clomid 50 milligrams. This cycle I am on Clomid 100 milligrams. So I'm kind of in the midst of like 3 or 4 different medications right now on top of my prenatal. It's a very generic brand. I got it from Publix, our local grocery store. Got it from Publix for like $5, like 30 capsules. So taking the prenatal, Metformin, Clomid, vitamin D3, and so far I feel okay. Nothing really extreme has been happening since I just been having a normal day. Excuse me, just a normal day. One thing I will say about the Clomid is that since I did move up the milligram from 50 to 100, I have more headaches this cycle. I am on day 4. Tomorrow is my last day, which is day 9. Today's what, day 8, I believe? Yeah. Today's day 8 of my cycle, and tomorrow's day 9, so that'll be my last day for Clomid, and then we'll just start testing with my OPKs. But anyway, I just want to give you guys the information on my HSG and different medications that I'm taking, and what I'm experiencing as of now. Other than that, you guys, I'm fine. Thank you for watching my videos. Me and Malcolm are very excited for our journey on trying to conceive our first child. Please jump on this bandwagon. Just watch, comment, like, subscribe. Just, you know, encourage us. We'll encourage you. So you guys take care and have a good one. Bye-bye.